In working with nurses and psychologists and behavior therapists, I've been able to gain a very deep level of understanding with every child that I assess. Their background and their expertise lends just a different perspective and a unique opportunity for me to see the child in a different way. And that just really helps promote better assessment, more accurate diagnosis, and better treatment. Yeah, the thing that attracted me to child psychiatry is that, in this a day of managed healthcare, time isn't afforded to the clinician to foster that patient-doctor relationship. And, I feel in child psychiatry, I'm able to do that and affect some sort of change early on. Being able to help a child through their difficulties and change their developmental and life trajectory is just an awesome privilege that I really enjoy. My philosophy is really rooted in treating the whole person. That's the reason I specialized in psychiatry in the first place. Is that I learned early on in medical school that if we're going to affect any sort of positive change, it's got to be done from a whole person perspective. And I learned something early on in medical school where we would view the patient or the person from a biopsychosocial model, and we look at not just the biology of illness, but also the psychology of it, how that person functions in society is important to look at. I really believe that it's really only through this perspective that we can really affect positive, long-term change for the kids that we see. So the thing that I would tell parents if they're on the fence about residential treatment, is that it's a scary decision. It's a very tough decision, but it's an essential and necessary decision that they have to make. If your child's life is defined more by failures than successes, if your child's life is dictated by depression and anxiety, I would definitely urge parents to really look at Rogers seriously, come out for a visit, and I would emphasize that there's so much in life that we want to make sure that children don't miss out on. How much more can we tolerate in terms of missing key social and developmental milestones? Rogers really emphasizes as an organization, emphasizes the whole patient approach. It really fosters that patient-doctor relationship, getting to know the whole person, treating the entire person, not just prescribing medications or not just doing therapy, but a combination of all of that, and also looking at the environment that they return to. I'm on the phone talking to providers after the discharge, and talking to schools and advocating for changes to be made, accommodations for kids all the time. So Rogers as an organization really fosters that and really encourages that.